Okay, next question is from Nicole. Good morning, Nicole. Hi, Dr. Ben. Hello. Yeah. I have seen several recent articles discussing the possibility that some people might have slight immunity. Okay, yeah, due to past common cold coronaviruses. Yeah, I know where this is coming from. What are your thoughts on this? It links to a Washington Post article about it. The Post. Wow. Yeah. See, is that the good one? Yeah. That is the good one. Yeah. Let's see. Okay, so what do we think about this? Well, so this is true. I think what we've got here is a disconnect. So, from a scientific perspective, yes, you can detect a little bit of antibody that must have been raised against some coronavirus of your past or just something that will actually stick to SARS coronavirus. Occasionally, even stick well enough that it happens to neutralize. These are sort of dumb luck, lucky hits, and whatever, you take them. Yeah. You can also detect a teeny tiny fraction of immune cells, things like T cells, that learned to recognize some part of the virus that happens to have not changed from some cold virus to this new one. And there are parts, things like the polymerase and helicase proteins of this one are 99% identical to regular SARS virus and within like 50 or 60% identical to some other common cold coronaviruses, beta coronaviruses. So yeah, that totally scans because each of these proteins and parts of the immune system is just recognizing a little tiny bit of the virus. They're looking for something like between, let's say, 8 amino acids and 10 amino acids out of thousands. And so, yeah, if you have a little patch where they happen to be the same and that happens to be something you can cut out and hand to your immune system and say, hey, go make a response against this, then yeah, that would happen. Now, at the level of science, you can say, yeah, there's a little bit of cross-reactivity. But then I think what people want is, will you have protection? And the answer is almost certainly not. So if you look at the amount of the response that you get in these people that are negative but have a little bit of cross-reactive, something in their immune system, the levels are really low. So compare this to animal experiments where they've done reinfection. Those animals actually have pretty good amounts of antibody and pretty good amounts of white blood cells. I'm thinking of the ferret study. There's another study, I want to say in rabbits, but I don't think it's rabbits. Yeah, it's probably a hamster or something. But forget that one because I don't remember it properly. But yeah, where they go in and reinfect the same animals after they've already had one infection. And in those cases, they can still infect, even though they have reasonably high amounts of virus. Generally, it's not as severe the second time in the couple of papers I've read. But, yeah. And so if a much higher immune response does not protect those animals, there's no basis for thinking that a much lower immune response is going to magically protect a person, I don't think. So, yeah. It's true, but it doesn't mean anything. Yeah, that you can actually take to the bank and use. So, so yeah, that's kind of one of these things that science turns up. It'll be a statistically significant result without any real meaningful difference in the world. Yeah. So thank you very much. This is Ask Dr. Ben.